Alberta has become the first province to require a personal health number to use safe injection sites.
This does not help the situation.
Mark Braverock leads the Sage Clan, an Indigenous group that monitors the streets of Lethbridge and offers support to the homeless population. He says the new rule creates barriers for those struggling with addiction.
More and more has been put on the addict to even sober up, and then even more work has been put on people who are frontline, who truly are frontline. It's been frustrating to see this new approach that the AHS has of mandating that you have to have a card stating a use so that they could use these consumptions. They can use that little trailer. They have to have cards, which they cannot keep. They don't have them on their person.
Advocate groups like Moms Stop the Harm and the Lethbridge Overdose Prevention Society have been fighting to reverse that requirement and filed a lawsuit back in August. Dr. Susan Edelman with Blood Tribe Health told APTN in August she supports the groups.
So by asking someone who probably doesn't have ID to provide ID and actually identify themselves when they're doing something that they feel they could be punished for anyways, they're just not going to use that facility.
Now the judge reserved his decision in that case, but while the courts decide, Alberta released a clarification stating this is standard practice for healthcare services when a new client is admitted. If the client cannot remember the number, the operator has a phone number to help the client retrieve it. If the client does not have a personal health number, the supervised consumption services operator is required to offer assistance in getting one. The province says no one will be refused services if they don't provide one. And Braverock says the Sage Clan is trying to hold on to health cards for those living on the streets.
We have tried to, in our own way, to keep their IDs and papers for them. But we're inundated with such a population, and to expect us to be able to handle that is getting beyond us. It is too much for us, because we do not have the resources or the support.
Tamara Pimentel, APTN National News, Calgary.